And welcome back. I'm Mabel, Jong. You're watching continuing coverage of the World Healthcare Congress here in Washington, D.C., and a special welcome to our virtual viewers who are joining us online. Stopping by our studio today, Alex DeWinter. He's director at GE Healthcare Ventures. We're going to talk about trends in digital health funding. Hi there, Alex. How you doing?
Good. How are you, Mabel?
Good. How would you describe the current environment of investing in different digital ventures now?
I mean, if you believe Rock Health, which is one of the it's an incubator and fund in digital health, and they track a lot of the trends in there. Digital health fundings continue to be up and to the right, and so this last quarter had the highest amount of venture capital going to digital health of all time. It was $1.6 billion in Q1 of 2018. Wow. And so there continues to be a lot of enthusiasm in the investor world, and certainly in the startup world, for funding into digital health.
And what's driving that?
Part of it is there is the recognition that digital health is sort of one of the trends that will hopefully help bend the cost curve in healthcare. So healthcare spending continues to increase faster than GDP. It becomes increasingly a larger and larger fraction of overall spending in the U.S. And so digital health has a potential of helping, I think, deliver healthcare to more people more inexpensively than current methods. So.
Well, are we still looking at, the potential of it, or are we realizing that potential?
I think at this point it's still the potential. I mean, so we're, one of the first places digital health will have an impact is in, certainly if you look at radiology.
Sure.
We spend, a lot of hospitals have equipment from GE and others, for example, very expensive MRIs. And then the MRI image comes off the machine and goes to a radiologist who then makes a read of the scan. Now, if the radiologist has had their coffee or not, it could impact the read of the screen. If they've had lunch or not, it may impact the read. If it goes to another radiologist at another hospital, the net result is if you have the same image given to 10 different radiologists, you might have 10 slightly different diagnoses. And that subjectivity could really be obviously it's a problem for the patient. It could be a problem for the payer if it results in a misdiagnosis. And what improves those reads is just experience, right? So if you have a radiologist who's 50 years or 30 years outside of medical school, they've seen way more scans than somebody right out of medical school. Mm-hmm. Now, on the other hand, if you have an algorithm that has the benefit of seeing millions of reads or millions of screens, you could argue there could be a better, more objective read of the screen. Okay. So that is just one area where it's just starting to make an impact, artificial intelligence and digital health, in terms of just improving and augmenting the radiologist's job. Mm-hmm. There are a lot of other areas that could come into play, but at least for me, the way I think about digital health and AI in healthcare, that's one area where it could have a big impact.
What is a wise investment, or what? There's so many different innovations now. How do hospital systems really go about, or how should they go about research and looking at what they should put their money towards?
Yeah, that is a challenge. So right now, if you're a hospital trying to figure out which, let's say, startup or technology to adopt, if you look at digital health, for every particular solution, there's dozens of digital health startups, and I think that's flipping the question around from a digital health startup standpoint. It's very difficult to actually convince a hospital system to adopt you, because you're claiming, we can solve this problem uniquely, and the hospital system says you're the 12th startup to say that.
Yes.
So it is very confusing from a hospital system standpoint which technology to adopt. One of the things we do at GE Ventures is we try to make those investments in startups after having done our proper due diligence, and then connect the hospital systems to startups that we've already vetted and invested in that we believe can help them solve those problems. So we certainly try to shorten the sales cycle that can sort of plague a lot of these startups by making what we'd call qualified introductions between startups and healthcare systems to help them solve their problems.
Is it pretty common for big hospital systems, at least, to have an innovation lab or some type of arm that is talking to entrepreneurs and innovators all the time to see what the next big thing is?
Yeah, there's it comes in a number of different flavors. Some hospitals have venture capital groups, similar to the way GE does. Some hospital systems have the innovation labs. I know Kaiser Permanente in particular has this sort of lab of the future or clinic of the future where they try out new technologies. And then a lot of hospital systems, actually the academic hospital systems, have groups within them that try to foster innovation that comes from within the researchers. So the researchers might have seen a problem within their practice, try to start a technology to solve that problem, and then seeing, well, could this be a standalone business? And there are groups within hospitals. I know Brigham and Women's Hospital in Boston, where we both are, has a group that does this, where they try to evaluate those technologies and foster them along, put them in touch with entrepreneurs who can help them turn that into a business. Okay. So there's a lot of different ways of addressing that. Yeah.
Has there been any discussion about the actual consumer of these products, the consumer, that there might be some fatigue or frustration with technology, and are there solutions being developed to address that?
There are, yeah. There's, well, I think from a consumer standpoint, there is still this question of how we are ultimately going to be consumerizing healthcare. I think a lot of people who are patients, either chronic disease or otherwise, at least I know as a patient, I don't like being reminded constantly of my health status. And so the question is, how do you manage to intervene in a person's day, let's say, and steer them away from a burger towards broccoli without annoying them and having them just turn off the app or erase the app? I think that is still being figured out, some sort of gamification of healthcare. And there may be some fatigue in there. I mean, it seems like a lot of people who had the Fitbits of the world and the initial wearables tried them out for a while and, to your point, became fatigued with them and just left them in their sock drawer. I think that first generation of wearables and consumer interface of healthcare is sort of starting to pass. We're getting to a second generation, which is a little more integration with other devices, like the Apple Watch, for example, has other functionalities, but among other things, it has a pedometer on there and tries to get people to walk more. So you're starting to see a way of trying to make it so that it's a little bit less all about healthcare, but it's sort of healthcare as a side effect of what you're doing.
All right, Alex de Winter, thanks for stopping by.
You're welcome.
Really appreciate it.
It's a pleasure to meet you.
And I'm Mabel Jong. Thanks for tuning in. We'll have much more coming up. Stay with us.